Good afternoon, everyone. My name is Ethan Minkin. I'm an attorney at Sliwoski. I primarily practice in healthcare law as well as complex civil litigation. And today we are here to discuss the new healthcare compliance guidance that was released by the Office of Inspector General, which is housed in Health and Human Services. It is the first major update to healthcare compliance guidance since the 1990s. And we expect in the coming year and years that we will see more specific guidance for various industry participants. This year, we expect to see something on Medicare Advantage plans and nursing homes. So before we get started, I'm very happy to have two presenters with me today. The first is Sheryn Honest. Sheryn is the principal at the Honest Approach, which is a healthcare consultancy. She is an expert in compliance plans, compliance guidance, and when I worked with both Sheryn and Ambika at a healthcare entity, Sheryn was the director of compliance, and she brings a wealth of experience in healthcare. She has many other specialties as well. We also have Ambika Kanta. Ambika is a senior director of quality improvement at Astrana Health of Nevada. She likewise has a wealth of background in the healthcare industry and many expertise as well, including HEDIS, risk adjustment, and I could go on probably for an hour, but I won't. And so in any event, we are going to get a perspective, I think, that is unique from people that do this stuff and have done this stuff. If we can go to the next slide, please. This is our agenda. I'm going to briefly cover fraud and abuse laws and compliance plans and mitigation. And I say briefly because each one of these topics could easily take a full day to discuss, and we just don't have that amount of time. So in any event, we are going to try to move quickly through our agenda today. If we could go to the next slide, please. So to kind of lay the groundwork to get to compliance guidance and what's important, we first have to understand the fraud and abuse laws, which really are the backbone of why we are here today. And so the first is the anti-kickback statute, which is a criminal statute. And literally at the highest level, it's you can't pay for referrals. Now, the statute has many other things as well that you can't pay for. And really, they use the term remuneration. So it's not just payment. It can be other types of remuneration as well. The second major law is the Stark Law. That applies to physicians who have a financial interest in a healthcare entity. And it also includes their immediate family members that may have a financial interest in another healthcare entity. And again, at the highest level, you can't refer to those entities. A physician can't, in which he has a financial interest. The Stark Law is a civil law. For both the anti-kickback statute and the Stark Law, there are safe harbors. And there's many safe harbors. And if you are able to meet every element of a safe harbor, you are immune from prosecution. The next major law is the False Claims Act. And that really is what it sounds like. And probably the easiest example is a provider cannot submit claims for a patient they haven't seen. And some people may say, well, that never happens. It happens. But it gets much more complex. There's a lot of issues about medical necessity as well, and whether or not a service was necessary. And if it's not medically necessary, a provider could look at a false claim as well. If you violate the anti-kickback statute, or the Stark Law, I can almost guarantee the federal government will bring a false claims count as well. The last big law are civil monetary penalties. And those are penalties, financial penalties that are enhancements to the other penalties under the specific statutes. And it gets very expensive if you violate one of these laws. In general, the civil monetary penalties provide between $10,000 and $50,000 penalty for each violation. So if you submit 10 false claims, let's say, you could be looking at $100,000 to $500,000 in just civil monetary penalties. State law also matters and also should be covered under a compliance plan. State laws vary from state to state, and some actually have corollaries to the big four federal laws. They're generally a lot more vague and a lot more specific about what it applies to. But it's important to be cognizant of those laws as well. And again, when it comes to compliance plans, you typically are going to design your plan around these laws and the risk that you have under those laws. If we go to the next slide, please. So throughout the OIG's guidance, it talks about mitigation, mitigation of risk. And I think we all understand what that means. In the 90-page document, though, there is one reference to the legal implications for mitigation. And I've highlighted that on the slide here. So what does that mean from a legal perspective? What is mitigation? And if we could go to the next slide, please. There is the United States Sentencing Commission guidelines, and that is used by federal judges to determine the appropriate criminal penalty. And it's a grid. You look at the violation and various factors, and it gives you a range for a penalty. Now, the penalties can go up if there are aggravating circumstances. And so that's what we see in the bullet point. It's Romanet 1 through 4. And for our purposes, it's the involvement in or tolerance of criminal activity, as well as whether the healthcare entity has a history of violating the laws. And again, a compliance plan will hopefully alleviate those type issues. Can we go to the next slide, please? So importantly for our discussion, there are also two factors that can mitigate or lessen the potential penalties. And the first bullet point is really why we're here today, the most important of all, and it is the existence of an effective compliance and ethics program. And when it says effective, it means that you can't come up with a document that's your compliance plan, policies and procedures and other things, and then just put it on a bookshelf somewhere and forget about it. That is not an effective compliance plan. That will not lead to mitigation from the legal perspective if the feds indict an organization. So this is why we were here. And I'm going to turn the presentation over to Sheryn to talk about what a compliance program is.
Thank you so much, Ethan. I appreciate the introduction. Now, to answer that question that you have of what's an effective compliance program, the only way I can really answer it is it depends. It depends on the organization, the size and the scope of the organization, the types of services they provide, how big or small they are. A compliance program or a compliance plan is not a one-size-fits-all program. It will be based on, like I mentioned, the size, the scope, how big or small that entity is, the work that they're doing. Now, with the 7 elements of a compliance plan that you see listed here, this is kind of the guideline that the OIG has provided to us in order to develop a good compliance, an effective compliance plan. So, we could sit here, as Ethan mentioned when he was talking about the big four laws, we could sit here all day to try and discuss the 7 elements. But because we are limited on time, as we go through the presentation, I'm going to touch on a couple of different areas for entities to consider. Next slide, please. Now, this is a list of the 7 elements, along with some of the common policies that are associated with those particular elements. I'm not going to read the slide to you, but I will be covering some of these as we move forward in the presentation. Next slide, please. Element 1 is your written policies and procedures. Now, this is a way having policies and procedures to guide your organization on the standards and requirements that are expected from relevant individuals. And relevant individuals are, in just a general perspective, anyone who works for or does work on behalf of an organization. Now, that could be your employees, your contractors, your vendors. It could even be a patient. Now, the written policies and procedures can be organization-wide. So, for example, your code of conduct and your compliance plan will give you what the expectations are as far as the organization's mission, vision, and values, the ethical behavior that is expected within the organization. They'll also list out the federal and state laws associated with the organization that the organization will be expected to follow as well. Or in addition to an organizational-wide type policy like the compliance plan and code of conduct, you could also have department-specific or role-specific policies and procedures. Next slide, please. Your written policies and procedures need to be accessible to the relevant individuals. And when we say accessible, on your intranet, on a website, it could be in a policy management system. It could even be on paper, whatever works and fits within that organization. And ideally, before actually implementing that policy and procedure, you want to try and distribute it to those individuals so that they have a view of what is expected of them and what standards that they have to follow once that new policy or updated policy is actually implemented and put into effect. You also want to have one repository for all the policies and procedures to be managed by that policy owner. Trust me when I say it's very difficult to manage different content within a policy or even versions of a policy when those policies are on an individual's laptop or computer. Because you can never necessarily know what the latest and greatest is. So ideally have one repository where all of the different policies and procedures are housed. And sometimes it even becomes a fishing expedition looking for the most recent policy and procedure. If it's not in one repository, let's say, for example, if that policy owner has exited the organization, trying to find that most recent policy to submit to an agency or an auditor becomes very difficult. And whether it's an internal audit or an external audit, you want to be able to track and document when you have distributed the policies, when they were reviewed by the staff, because that's the type of evidence an auditor will want to have once they are looking at certain policies being implemented and followed. You also want to test for understanding. Is that policy written in a way that everyone can understand? Is it in an appropriate reading level? Is it written in plain language? And you may also want to consider language translation. If, for example, your population of relevant individuals, if you have a large population where English isn't their first language, you may also want to consider actually having some kind of translation to that policy to help in the understanding of it. You want to make sure that your compliance officer and your compliance committee are available to the individuals within the organization to answer any questions about any policy that's just been released. It makes it very easy to be able to respond to questions. This helps in managing the actual accuracy of the policy, as well as potentially mitigating risks as people ask questions about certain let's say items within a particular policy. So you want to make sure that your compliance officials are available and accessible to your staff. And definitely you have to review and update your policies and procedures and make sure that they're maintained at least on an annual basis, if not more frequently. And more frequently, let's say if a law or a regulation has changed, or if there's something that's been updated within the organization itself, you'll want to make sure that you look through your policies and make sure that they are updated to whatever changes have just occurred. Next slide, please. Now, this is a list of organizational-wide policies and procedures that are pretty common. Again, they're based on the size and structure of an organization, so you don't necessarily need to have every single one of these listed individually. You may be able to have, if you're a smaller organization, you may be able to have your conflict of interest policy and your gift and gratuity policy rolled into, let's say, your compliance plan. It really just depends on whether, what the size of the organization, and if you really need to have a separate document to show that you have that policy and procedure available. Now, we've already touched on the code of conduct a little bit, as well as the compliance plan. And another important policy and procedure to have, especially for healthcare organizations, is your HIPAA privacy and security policy. And this policy sets forth the standards that are expected on how an organization will keep and manage, maintain, and protect a patient's protected health information. So this will allow also in stating how that organization is going to allow the use and disclosure of a patient's PHI, their protected health information, so that they can get adequate access to care in a quick and timely manner, and so that they also have quality of care. So you need to manage how that information is distributed and sent out as well. And your HIPAA policy and procedure, privacy security procedure, will help with that. Next slide, please. Element 2 is leadership oversight. Now, this policy will set and actually reinforce the standards and the culture of ethics and compliance within an organization. They need to be demonstrated by your top leaders, your board, your executive team, your managers, your supervisors. Auditors are going to look not just for that policy and the words on the page, but they're going to look to see and make sure that that policy is being followed and actually demonstrated, and that you're able to track the information within that policy and the distribution of it, and you test for understanding. Now, prior to the new compliance guidance that came out, typically the oversight of the compliance function laid with one person, with the compliance officer. Now, with the new guidance, it's not just one person who has that function and oversight of compliance. The OIG expects the board, as well as the compliance committee, to have a much more accountable status within the compliance program to help support and make sure it's implemented appropriately and that it's running smoothly. You want to make sure also that you have adequate resources and budgets that are assigned to the compliance function. Now, this is also depends, again, on the size and scope of the organization. So smaller organizations, may have someone in the compliance function who also has other duties within the organization. A larger organization, you may have multiple people within that organization in a compliance function. So it just really depends, again, on the size and scope. And the organization itself will need to determine how many resources and budget is going to be allocated to the compliance department based on the work, the scope of work, as well as the size of the entity. And just keep in mind also, the OIG does look at separation of duties within the compliance function. They want to make sure that, people who are in the first line of providing healthcare services and or potentially in the revenue cycle area, doing coding, billing, documentation functions, don't necessarily have a responsibility within the compliance function. They want to make sure that those functions are separate than compliance. Next slide, please. Element 3 is your training and education. Now, this is going to be based on creating your training and education program. It's going to be based on your organization's risks and and different lessons learned, let's say, through audits. So, for example, some of the risks that are out there could potentially be, coding and documentation for a healthcare provider. It could definitely be a data security risk. for a clearinghouse. So we've just recently seen the Change Healthcare incident that occurred. So data security is also a risk that we all in the healthcare industry would face. Also, for health plans, it could be their sales and marketing practices. That could be a risk. So you want to train towards whatever the organization's risks are. And you also want to make sure that within that education and training, you're also stating what federal and state laws are applicable to the organization so that everyone can be aware of, the potential consequences of non-compliance with them. You want to have targeted training and education for the people who are within the organization. So let's say, based on a position or role, let's say, for example, you have the board, you want to make sure that they have specific board training. Your coders and billers will have specific training associated with them. They're going to have the organizational wide training, but there should also be targeted training so that they understand specific risks associated to their positions and the work that they do and that they're responsible for. And finally, you want to make sure that your training is accessible to your diverse staff, right? Culturally accessible, it can be available in different languages, provided in different formats. It could be in person, videoed, it could be in a training management system. So you want to make sure that it's accessible to the way different people are able to view that training and education. Next slide, please. Element 4 is an effective communication policy. And this means having an open line of communication. And that could be, and should really be, having an open door policy for the compliance officer. Everyone within the organization should know how to contact that compliance officer, know how, there should be information posted in places that the staff frequently are in. Let's say a break room or around a nurse's station if you're in a clinic. You want to make sure that they have access to that compliance officer's, email. They can contact by phone. They can, have a compliance portal that they can access if they want to report a concern. And you really want to be able to, from that compliance function, build trust within the organization. Make sure people feel safe and understand, there is confidentiality when they come forward with different concerns. So unless there's a requirement that some information needs to be shared, there is confidentiality when someone comes to your compliance officer or compliance department to express a concern that they have. Now, and if an individual does come forward in good faith to report a concern, you also want to make sure that they understand that retaliation within the organization will not be tolerated. Typically, in a non-retaliation policy, you will state that very clearly. So in good faith, if someone comes and reports and says, I've seen X, Y, and Z, they should not be afraid that, they're going to be, let's say, shunned or someone would look to potentially terminate them because of reporting this concern. There are protections there, and it should also be listed within your non-retaliation policy. And another way to continue to build that trust within the organization is to make sure that everyone knows how to report concerns, whether it's internally, with a hotline or a compliance portal, or even externally to federal and state agencies. They should be given that information so that they have the ability and the comfort level to be able to report wherever they are comfortable reporting. Because the main idea is to identify an issue and then mitigate that issue. However you get that information is one thing. I mean, there's definitely anonymous reporting as well that you could have through a hotline where they don't have to leave their particular details or information, but just express their concern and provide any information that can help along with the investigation. Next slide, please. Element 5 is enforcing standards. Now, this policy will describe how an organization is going to handle actions that are non-compliant or don't adhere to a policy and procedure or standards or laws. It should, describe what steps are going to be taken, how an investigation is going to be handled, and what are the potential remedial actions that are going to be taken. Consequences of non-compliance, could be based will be based on the severity of the actual incident itself. It could be just education and retraining of a staff, a non-punitive type of consequence. Or it could be all the way through termination and criminal prosecution, depending on if it's a criminal act. So there are definitely different consequences for noncompliance, and your enforcing standards policy should list some of that information as well. And with incentives, this is where your compliance committee as well as compliance officer should develop some type of way to encourage individuals to actively follow that compliance program and support the compliance program. Now, incentives could be, through recognition. It could be a monetary or compensation incentive, or it could be another small gesture. I know one of the organizations that I worked with, we developed an annual training competition. So, throughout all the different markets and all the different departments within that organization, we said, okay, here's the different training that you're responsible for. You have a deadline date. Everyone within that department who completes that training by that deadline, that department's name then goes into a hat. We selected three different departments out of the hat, and those three departments who everyone within that department had completed the training within that target date would receive lunch. So, those are small gestures. It could be small, like gift cards to Starbucks. You have to consider the monetary value, and you'll want to work with your compliance team and legal team to make sure that whatever compensation is given in recognition and incentives is within appropriate guidelines. But the OIG does encourage incentivizing individuals as well. Next slide, please. So with element 6 is auditing and monitoring. You want to make sure that you have an appropriate reporting system in place. How can people report their concerns? And we've talked about that a little bit, right? It could be anonymous, it could be a compliance portal, it could be in person to your compliance official. There could be many different ways an organization decides and determines how that reporting should take place. It could even be a drop box where somebody could anonymously drop a note into a box where the compliance team monitors frequently. Then you want to make sure that your policy will describe how risk assessments are conducted. Risk assessments should be conducted at least annually, and they're really there to identify and prioritize the top risks within your organization. Once those risks have been identified, then you want to develop your auditing and monitoring work plan. You'll identify at that point, an audit schedule. You'll create an audit schedule of those top risks that you want to audit and determine, do I need to audit this risk monthly, quarterly, yearly, and then develop an audit process, which will determine, what's the scope of the audit, who's going to participate in the audit, what data do you need to collect for that audit in order to have evidence towards whether or not that particular area is being compliant with the audit requirements. And once that audit is completed, then you want to have, determine whether or not you actually need to have ongoing monitoring. Now you can change, the frequency of it. You can change the timing of an audit and the ongoing monitoring, just depending on what the findings are. And you may also need to, issue a corrective action plan. Now, if a corrective action plan is necessary, it'll typically identify what deficiencies were found with the audit. It'll request that a root cause analysis to be conducted. And Ambika is going to touch base a little bit further on the root cause analysis, so I'll just, I'll move on. You also will have a target date of when the corrective action is going to take place, and then who's responsible for that corrective action to take place. Next slide, please. Element 7 is responding to offenses. Now, offenses can be, again, detected in multiple ways, and we touch base on that, through the different reporting systems, anonymous, patient complaints, directly to the compliance officer. But once these issues have been identified, you have to then determine whether or not an investigation is needed. If an investigation is needed, you'll interview the different individuals potentially involved or who have knowledge of the different issue. You'll want to then review documents and data analytics, and then determine what that impact is of that and the extent of the offense. Depending on that extent of the offense, you may need to coordinate with your legal department and your legal counsel to help you navigate through any legal implications of that offense. And then you also want to consider whether or not that offense is reportable to the government. Did it violate the law? As Ethan mentioned, those big four laws, your anti-kickback, your Stark, the False Claims Act, the civil monetary penalties. Did any of those, the offenses or the issue that was found throughout the investigation, did that violate a law? Is there a patient safety concern? Do you need to report to the government, and how do you report that? Now, OIG, what really OIG wants to see is, so an organization promptly reporting any kind of offenses, utilizing the voluntary self-disciplinary program that they have in place, which helps then individuals and organizations to report concerns and to self-report. And this really, when organizations self-report, it really shows and demonstrates the clear message of that organization operating at a very high ethical and compliance level. Next slide, please. Now, there have been, in general, the compliance program guidance hasn't changed a lot. However, there have been some changes. This new program guidance provides additional clarity and emphasis in certain areas. However, there are new areas that the OIG is going to, put a little bit more emphasis on and look at further into in the future. So, for example, you have new entrants into healthcare. You have technology companies, who support healthcare providers with different, let's say, applications or other data analytics services, who are new entrants. You also have private equity, who are new entrants into the healthcare industry. And these new entrants may or may not understand the full extent of the regulatory requirements in healthcare. They may not be familiar with the healthcare landscape. So these are definitely areas that the OIG is going to be looking at, as well as healthcare organizations already in existence, but who maybe are looking at a new line of business. They may be going to a different new service line, which they may not be familiar with. So they're also the OIG will keep an eye on these new entrants into the healthcare industry. The new guidance also provides additional clarification within the small and large entity compliance programs. Now, for all intents and purposes, the expectations are similar, but the guidance does acknowledge that there are different resource capabilities between small organizations and larger entities, and gives some clarification on what's expected. The OIG resources within the guidance are phenomenal. I would really recommend everyone take a look at it, and ideally online. And online, because within the document, when you pull it up online, there are a plethora of hyperlinks and information to other websites and guidance that will be helpful if and when you're developing or updating your compliance program. Also new is the quality and patient safety requirements from a compliance program perspective. I'm going to go ahead and turn the presentation over to Ambika, who will go a little bit further into this area. Thank you.
Thank you so much, Sheryn. Appreciate being here with everyone today. So really to touch on the quality components that have been recently introduced into the new guidance. Historically, we haven't seen that. We haven't seen that published before around quality, but now it's becoming more evident. And by quality, really defining it as quality of care and patient safety. So these are things that you might see in current regulations like the AHRQ or Joint Commission. So, slips and falls, things like needle sticks. Those are all areas related to and around quality of care and patient safety. Now, traditionally, we've seen this more focused on acute or post-acute facilities and residential care. And the guidance of the OIG is also pointed a little bit more towards those facilities. But that doesn't mean from an outpatient setting we can't incorporate that into our compliance plans. And that's definitely a recommendation I would give to all organizations, making sure that you do have something in place for quality of care and patient safety. And first and foremost, that can look like, risk assessment, doing that as Sheryn mentioned by department, doing that on an annual basis at least. But also another way you could kind of capture quality of care and patient safety is through tracking and monitoring of grievances. So grievances are also synonymous with complaints. For purposes of today, I'm going to refer to them as grievances, but none of us have, we're probably not too unknown about grievances or complaints. We've seen them. Patients are very eager to share their thoughts and experiences of our facilities and care. These are also things that end up being published in various platforms. So tracking those is a great way to capture quality and patient safety. So just for example, you could have a centralized location or centralized person repository, whether that even be a spreadsheet, could be paper, but let's try a little more automated, but could be a spreadsheet of tracking those complaints and then identifying them in categories. So, was this complaint based on perhaps a delay in medication? Or as mentioned, was this based on a needle stick or something that we also need to classify a little bit differently? Perhaps it was a procedure or surgery that occurred on the wrong limb or wrong area. Ideally, that doesn't happen, but it does. So we want to track and monitor those. So categorizing them first, and again, you can refer to the OIG's kind of a toolkit that's provided. And then from there, sort of subclassifying them as what type of harm event. Could this have been preventable? Was there severe risk to the patient? Was this an event that was of significance? And then from there, definitely encourage you all or groups to really consider including physicians in the process. So if non-clinical staff or even clinical staff are monitoring these grievances, identifying how and when to bring in the physician for review. This commonly in kind of the NCQA world is referred to as peer review, but also from the standpoint of grievances, if these grievances become a trend for a certain provider, a certain facility, it needs to be looked into further. Perhaps that could impact contracting or credentialing with those groups. So really from something that we're all dealing with, such as grievances, tracking those, having someone responsible, identifying categories for them, bringing in your physician, and then from there kind of creating plans going forward to negate that risk from in the future and prevent it, and then ongoing monitoring as that's been discussed today as well. And this really pans into all departments. So not just quality and patient safety, though this is paramount that now we're seeing it brought in by the OIG. But as Ethan previously mentioned as well, billing and coding, those are areas, false claims that have continued to be audited. Another area that we'll probably see in future years with more focus is going to be risk adjustment, still related to coding, but in the sense of appropriate coding, just like our fraud, waste, and abuse and false claims, really ensuring that organizations are coding and doing diagnoses appropriately pertaining to that patient, that there isn't any false information being captured. Another area or department to consider is going to be contracting, right? So your arrangements and your agreements with those groups should include components of offshoring. If that component is available or something that needs to be taken a look at further, is that something that is authorized, or maybe it's not authorized? So ensuring that that's captured in your contract along with remuneration. So payment for services, that if you are having or are entering into a capitation agreement, that is all laid out, clearly specified, does align with billing and coding regulations at the same time as well. And then from a credentialing standpoint, I touched briefly on peer review, but peer review would tap into credentialing. If the provider or group or facility has a significant number of grievances where there has been patient harm, perhaps that that entity should not be credentialed or part of your network or part of your contracting as well. So doing those OIG, GSA checks, and not just doing them once on an annual basis, but having those regular checks in place as well to ensure you're staying on top of those, you're tapped into anything that could have taken place, and you have a process aligned to support that with any delegated activities. From the prior authorization and utilization management standpoint, really ensuring that those services are based on medical necessity. So from here, as Ethan mentioned, kind of the Stark Law, we don't want to steer patients into an organization or a facility we have ties with. This should solely be based on medical necessity and who is in your network. That is a big piece to really consider with prior authorization in UM. Along those same lines, monitoring utilization management. So perhaps as you're processing those authorizations, you're also tracking, the specialty or subspecialty they're going to. From that standpoint, you're able to see, from the outpatient or PCP perspective, could the service have been provided within that entity? Or are we overutilizing services? So taking a look at that, again, bringing in your physician, having that conversation, and that could be tied back into contracting or credentialing along with billing based on those services. Moving on to considerations for really a compliance plan, an effective compliance plan, ensuring that you have policies and standards and workflows outlined, doing those risk assessments by department at least annually. As mentioned, that can be become more frequent based on regulations or updates that are made by the government or even state entities. Perhaps also your organization has gone through some changes, maybe combining of departments, changes in leadership, perhaps you streamline some workflows. So those are reasons why you might want to reconduct a risk assessment, update your policies and workflows. Other things I recommend for departments and organizations to keep in mind is using the tools you already have available to you. So if you have any sort of automated system, a lot of them have reporting capabilities. Maybe they're canned reports you can use to collect data. Perhaps you can gain or gather more data through a uni or bidirectional interface from the standpoint of care management or even utilization management, being able to get data from the hospital systems or your state health information exchange. Those are all great ways to maximize your data and then be able to analyze it closer to identify where there are opportunities or areas for improvement. And then, simply put, monitor your programs, monitor your policies. When you're doing that risk assessment and you're analyzing that data, bring in compliance, bring in your quality teams, conduct mock audits. Those are great ways to get ahead of any audits you're facing, whether it's Joint Commission, a CMS audit. Ideally, you're doing those already, but if you're not, start out annually, increase those to quarterly, and then get them going monthly. And look at your data. Your data is going to tell you and show you ways that there's opportunity for growth, or maybe you're succeeding at something and that's a best practice you might be able to share. And as Sheryn mentioned as well, committee review, having a committee that is going through your policies, is going through your data to see, maybe that it ties into another area. So for example, from a monitoring and utilization standpoint, maybe that is actually tied into the way that the contract language is posed. So from a committee, having a committee available will allow for kind of a collection of ideas and groups coming together to solve for those problems and create improved processes. And really from the corrective action plan standpoint and root causes, that's going to happen, right? We're all growing, we're all improving. You might identify something that needs to be stopped or ceased immediately. So start that investigation. Again, bring in your committee, identify subgroups that can support, create that impact analysis. How many providers or patients were impacted by the action or activity that was previously occurring? Identify ways to remediate. So maybe you need to put in a plan in place or a process in place so that this doesn't happen again. You're preventing or mitigating that risk in the future. track your effectiveness, create those audit tools, again, lean into systems and tools you already have in place. From an AI perspective, as that's coming to the forefront, perhaps your data team can support you in your AI may be looking at some of the language you're using in contracts, or maybe your AI can help with kind of automating some of the reporting coming out of your system. So there's different ways to tap into that. And then always, first and foremost, if you have identified something that was an opportunity for improvement or something that did cause risk, self-disclose that in your audits. It is a conversation that might not be the most comfortable to have, but then the auditor or the organization auditing you, again, will deem your organization or your department as one of high esteem because you are monitoring your compliance. You are taking those steps forward, and you're doing something about the problem or the issue that you found. So an example for this really, I'll relate it to prior authorizations and utilization management, and it also ties into claims, but entities that are health plans or global risk for these services have to send out a denial letter to patients. And so those are formally termed as an integrated denial notice or an IDN. And those denial letters have to be in easy to understand language. And sometimes that can be a little bit tricky when you have clinical teams maybe writing your denial letters. So in this instance, I recommend maybe having a non-clinical team member audit your denials for that easy to understand language. You can create a tracking tool, ensure all of the key points are met, the reason for the denial, what criteria was utilized, why it was denied, and then sort of recommendations thereafter. And that non-clinical person can continue those audits and give you feedback to track that effectiveness, allowing that organization to move forward and successfully implement or administer denial notices that are easy to read. So all in all, we have tools and resources that we've touched on today collectively as a group. Guidance, as mentioned previously, has been around since the 1990s. This last year saw some new improvements in guidance and publications. And as Ethan mentioned, this year we'll likely see some additional guidance around Medicare Advantage and nursing homes. So please check out these links and resources available to you. And appreciate going through this compliance training and education with you today. Our hope is that these tools and resources are useful, and some of these examples allow you and your organization to be successful in providing an effective compliance plan and quality care to your patients. I will turn it over to Ethan for any questions from the audience.
Yes, I have some questions. We talked about Sheryn and specific policies and procedures and a compliance plan, and that can sound very daunting to have to put together a program. Have you seen like off-the-shelf policies and plans that you can start with and then tailor from there?
There are some templates, Ethan, that are out there that kind of give you some of the standard areas that you want to look at. For example, in a compliance plan, it might give you the heading topics, but really writing these policies and procedures, it's not like a book on the shelf. They have to be really tailored to the organization, because using a standard template may give you the subject headings that you need to include within that policy and procedure. But really, it's based on the risk of the organization, the scope of the organization, and the size. Because it might be, a 1 or 2 doctor practice may have certain, requirements that they have, whereas a larger entity would have, maybe trouble the requirements that they need to have. So it's really going to be based on that specific organization. So there's some templates that'll give you like the topic headings, but you really have to look in depth within each of the areas of that policy to tailor it to your organization.
Great. I've always found that the auditing and monitoring piece is the most difficult, at least as a lawyer, because we're not as familiar, right, with how the organization and the specifics. Do you have any, either one of you, tips when it comes to identifying, areas to audit, how that is developed?
Definitely. From that standpoint, I'd probably use past audits the organization's gone through. So if they have any tools or resources that were previously used, tapping into those, you don't have to recreate the wheel, using that as a baseline. And also from the standpoint of regulation, if there is the entities going through an audit from, CMS or Joint Commission or NCQA or URAC, there are generally some loose templates that are available as far as what will be audited during that time frame. So using, maybe if it's verbiage, taking that verbiage and turning it into an audit tool, and making those into metrics. So you can identify from the standpoint of, the auditor, we're looking for a complete file with demographic information, or from the standpoint of credentialing, looking at it with not just demographics, but a CV, an OIG check, that the licensure was verified. So taking those existing resources that exist and kind of turning that verbiage into a way or a means of monitoring using a simple spreadsheet.
That's great. Sheryn, anything to add on?
Yeah, I'll just add just one thing. As you mentioned, Ethan, if you are an attorney trying to identify, what those some risks are, you may want to see if that organization has conducted a risk assessment and get a look at that, because then that will kind of tell you and lead you towards, okay, here are the risks, and then you'll be able to, further delve into, okay, these are the top 3 risks, and these are the things that we need to make sure are covered. As I'm leading the client towards whatever solution is needed. So if they have a risk assessment that's been conducted, that might be also a good area to take a look at to see what they themselves have identified.
Thank you. Yeah, it's a hard area, but obviously an extremely important area to be able to monitor and audit, and make sure you're not finding any issues, and identifying those areas where there are potential issues. I think that it's a difficult task, and it's good to hear these tips. Sheryn, I don't know how much you can talk about this, but I know that earlier this year you were part of a work group that was assembled by Medicare to discuss the individualized plans for Medicare Advantage plans, which, for people that aren't familiar, that's essentially managed care within Medicare. It used to be called Medicare Plus Choice. Now it's called Medicare Advantage. So in any event, I don't want to talk too much. Is there anything you can share from that?
Sure. Yes. So, I was really honored. The OIG invited me to participate in the focus group that they had around Medicare Advantage and first-tier downstream related entities. What I can say is it was a small group of individuals that do work within the Medicare Advantage space. There was healthcare attorneys, people working in the industry on behalf of health plans, other consultants. So, we discussed, and the questions, were really left general, to get our input. So, when the OIG legal team was asking, they were just very open-ended questions. And, we were able to provide the pros and cons of our past experiences and the things that we had been able to see. And definitely, a couple of the items that did come up that is in the guidance that we just went through are the new entrants. So, they did talk about technology companies and private equity. So I'm pretty confident that at some point, those 2 areas, even though there might not be a specific industry specific guidance for technology and private equity, I believe that, the other areas that will have those ICGPs will have an element of technology and private equity within them, where people will need to, who are working, let's say, when they come out with the nursing home or the clinical laboratory specific, industry specific guidance, they're going to talk about private equity involvement or technology company involvement and things that are potential risks to those different areas. And so I'm pretty confident that some information, further information, will come out on technology and private equity as well. Those new entrants we talked about earlier in the presentation.
That's excellent. Excellent. And actually, one thing that was mentioned during the presentation specifically was, AI, artificial intelligence. Have either of you worked with an organization previously that used AI software? And if so, do you have any feedback from what you've seen?
I'd say we were exploring the option of AI, and that was related to utilization management. Software nowadays with AI can kind of compute the languages or verbiage within documents. So from a standpoint, for prior authorizations, being able to identify softly, does this documentation meet criteria and medical necessity based on all of the clinical information provided, and then sort of do a soft handoff there to the clinical team, reducing the time the clinical team needs to spend on delving into the documentation. The AI software would pinpoint areas to focus on, such as let's say that the patient was going in for surgery, and prior to the surgery, they needed to meet certain requirements like physical therapy, an MRI, joint injection. So knowing the AI software would know what the criteria was that was required to be approved, and it would kind of look for that information within the clinical documentation, be able to point it out, allowing the clinical staff to have a little more focus versus having to go through sometimes 100 pages of documentation. So I haven't experienced it quite yet, but there are lots of tools and resources out there that are definitely maximizing that potential.
Yeah, I always imagined that it would be an incredible tool to kind of lay over your claim system too, to look for potential like fraudulent claims, right? I mean, there are patterns that you can come up with that will help detect whether there's a potential issue. Sheryn, have you seen anything on the claim side at all with AI or not yet?
No, you know what? Not yet. I know that there are different advances that let's say the revenue cycle side is making. There are a lot of things from a coding and documentation perspective that they do have. I'm not sure if the right terminology is like a scraping tool, but it'll go and review the documentation and look for certain, let's say, diagnoses that are risk adjusting, that type of thing. So definitely there have been for quite a while now, AI supported. I think Watson was one of the first that I'd heard of years ago. Was one of the tools that was out there, but it is so. I don't want to say it's so new, but the emphasis on it and the new entrants working with AI. Just as it continues to develop, there's definitely going to be things that from a compliance perspective, anyone working in that AI field will want to make sure, that they have a very robust review of their program, of the things that AI is capturing, making sure appropriate consents are in place, whether it's, with providers, patients, that type of thing. Because you want to make sure that that information that's being, scrubbed through that AI system comes out with the most accurate information. Because ideally it's going to be there to bottom line, treat a patient and manage a patient's care.
Interesting. Yeah, I helped a client a couple of years ago negotiate its first AI contract to lay over its claim system. And what surprised me was how expensive the software was. I mean, it was not cheap. And maybe over time, that'll come down the pricing, but I was actually pretty surprised. But at the same time, I'm sure it's a worthwhile investment for a company. But there are risks, as the OIG points out, and that has to be considered as well, not just by the healthcare organization, but by the tech company that's developing that software. I mean, smart tech companies that work in healthcare, you know, they work to identify risk as well to, you know, to help the client and, you know, promote software that, you know, actually does a good thing. Well, I think we have 1 minute left, and I've got a lot of questions, and we're not going to cover all of them. So in any event, I think this is a good point to stop. I really appreciate Ambika and Sheryn taking time out of their very busy schedules. I hope this was educational for everyone. And I'm sure in the coming months, we will have further updates about the compliance guidance on the individualized side. Thank you very much. And before I forget, I think the slides are available for anyone that would like to download them. And if not, I think it will be posted on our website at some point for download. So thank you all for attending. We really appreciate it.